Hello everyone, my name is Mairead Moloney and I'm presenting today on behalf of my research team, Trace Hennessy and Dr. Owen Duty, and we're at the University of Limerick. And over the next 3 minutes, I'd like to tell you about our research on reasonable adjustments in acute healthcare for people with intellectual disability. There are approximately 66,000 people with intellectual disability in Ireland, and this number is growing nationally and internationally. And in Ireland, people with intellectual disability now live more socially inclusive lives. They live mostly with their families or with their peers in community settings. However, as Ireland moved away from the traditional institutional-based care, this also meant that people now must access mainstream acute healthcare services. And the research is telling us that when they do access these services, they are experiencing inequities and they are marginalised. So one way of addressing this is by the use of reasonable adjustments. And they are ways in which healthcare providers can change the way they work, adapt their services or their environment to help alleviate disparities. And examples might include things like using a hospital healthcare passport, or something even more simple like allowing longer appointment times for people with intellectual disability. So our research, we conducted two qualitative descriptive studies, one with parents, 6 parents of children with intellectual disability, and the second study was with 11 healthcare professionals. So from the parents' perspective, we found that they had limited or no experiences of reasonable adjustments when accessing or utilising acute healthcare services. When they did have their limited experiences, they were very ad hoc and individual level, and they often depended on the kindness of the healthcare professional that they happened to meet. Like one parent gave an example of a surgeon who provided reasonable adjustments for her son with autism, but it turned out that the surgeon also had a son with autism and he knew how to support the patient and the family. So again, it was very dependent on who you meet. Then from the healthcare professional perspectives, again, there was very limited evidence of system level or individual level implementation of reasonable adjustments. But it's important to point out here that healthcare professionals are very supportive of reasonable adjustments in practice. There's just no formal systems or blueprints to support their implementation. So to summarise, reasonable adjustments are very well conceptualised in the literature and they're very well advocated for, but there's very little evidence that it's happening in practice. So we need a very radical change in focus where reasonable adjustments are prioritised at system level by leaders and policymakers to ensure that the present and the future needs of people with intellectual disability are met effectively and equitably, leaving nobody behind. Thank you very much.